Most people think heart attacks come with clear warnings: chest pain, shortness of breath, or arm discomfort. But for about half of men and nearly 2/3 of women, the first sign of heart trouble is the heart attack itself. There's no second chance, no warning at all. You can look and feel healthy, exercise, eat well, and have normal cholesterol, yet still have a hidden, life-threatening condition. Heart disease is often silent, developing over years without symptoms. Waiting for warning signs is like waiting for your house to catch fire before installing a smoke detector. Prevention means looking for the disease before it announces itself in the worst way. We can't rely on how we feel or what we see on the outside. The real danger is what's happening inside our arteries, often completely unnoticed. The processes leading to a heart attack are slow and hidden, building up over decades. That's why we must move beyond a symptom-based approach. True prevention means searching for the disease itself, not just its late-stage symptoms. We need to be proactive, not reactive. The stakes are simply too high to wait for a warning that may never come. Understanding this silent threat is the first step to protecting ourselves. Don't assume you're safe just because you feel fine. The first symptom could be the last. The heart relies on arteries for its blood supply, and one artery is especially dangerous: the left anterior descending artery, or LAD, known as the Widowmaker. A blockage here can be instantly fatal, causing sudden cardiac death with no warning. Plaque, made of cholesterol, fat, and calcium, builds up silently in these arteries. Even a moderate blockage in the LAD is risky because it supplies a large part of the heart. The Widowmaker's name highlights how sudden and unexpected these events can be. A person can feel perfectly fine one moment and suffer a fatal heart attack the next. The problem doesn't appear overnight. It grows quietly, hidden within the artery wall. This explains why seemingly healthy people can die so suddenly. The real threat is the silent buildup of plaque in a critical artery. Understanding the unique danger of the LAD is key to recognizing the risk. Heart disease can be a hidden killer. How can a major blockage grow without symptoms? The answer is positive remodeling. As plaque builds up, the artery wall expands outward, keeping the blood channel open and hiding the problem. You can have a 40–50% blockage and still feel fine, even pass a stress test. The disease is there, but it's hidden. This process can continue for years, until the artery can't stretch anymore, and the blockage finally narrows the blood flow. By then, the disease is advanced and dangerous. The body's attempt to protect itself actually allows heart disease to progress silently. Not all plaque is the same. Some is hard and stable, causing predictable chest pain with exertion, stable angina, but the real danger is soft, unstable plaque with a thin cap. This type grows silently and doesn't cause symptoms. The risk is rupture. If the thin cap breaks, the body forms a blood clot that can instantly block the artery. This is the mechanism behind most sudden heart attacks. The blockage isn't gradual, it's explosive and sudden. Even a small plaque can rupture and cause a fatal event. Most sudden cardiac deaths in healthy people are due to this hidden, unstable plaque. You can feel normal, exercise, and have no pain, yet still be at risk. The real threat is not the size of the blockage, but its instability. Heart attacks often strike without warning because of this silent danger. It's not about slow progression, but sudden catastrophe. That's why early detection is so critical. Doctors classify heart attacks into two main types, type 1 and type 2. Type 1 is the classic heart attack. An unstable plaque ruptures, a blood clot forms, and the artery is suddenly blocked. It's a plumbing problem, like a pipe suddenly clogged by debris. This is the most common and deadly type, often striking without warning. Type 2 is different. It's a supply and demand issue. The arteries are narrowed, but not suddenly blocked. The heart just can't get enough oxygen during stress or illness. Imagine watering a garden with a narrow hose. On a hot day, the garden needs more water than the hose can deliver. Type 2 heart attacks are triggered by increased demand, not a sudden blockage. Both types are dangerous, but type 1 is the silent killer that often strikes healthy people. Understanding the difference helps us recognize the hidden risks. Many believe normal blood tests mean their heart is fine, but that's a dangerous myth. Standard tests measure risk factors, not the disease itself. You can have normal cholesterol and still have dangerous plaque. The real disease is atherosclerosis, plaque in the artery wall, which standard tests miss. So how do we find it? Advanced imaging. A coronary artery calcium (CAC) score is a quick CT scan that measures hardened plaque. A score of 0 is excellent. Higher scores mean more risk. But CAC only shows calcified plaque, not the soft, unstable kind. For a complete picture, a CT coronary angiogram (CTCA) is the gold standard. It shows both hard and soft plaque, revealing hidden disease. These tests can uncover problems before symptoms appear. Don't rely on basic tests. Ask for advanced screening. Knowing healthy people can have heart attacks should empower you to act. Don't assume you're safe just because you feel good or your tests are normal. Talk to your doctor about your real risk and ask about advanced screening like a CAC score or CTCA. Lifestyle still matters. Eat whole foods, avoid processed junk, and exercise regularly. Aim for at least 150 minutes of moderate activity each week. Manage stress. Chronic stress raises your risk. Get 7-8 hours of quality sleep each night. Think of your heart like your car's engine. Don't wait for it to break down before checking it. Prevention is the best investment in your health. Take control. Combine advanced screening with healthy habits. Don't wait for symptoms. Be proactive. Your heart deserves regular attention and care. Early action saves lives. Protect your future by protecting your heart now.